Hi friends, we are here in the demo space of one more of our partners, Functional Diagnostic Nutrition. And I'm going to talk about this solution with the founder, Reed Davis.
Well, thanks very much. Of course, Functional Diagnostic Nutrition is a methodology where we look at the underlying causes and conditions. We use functional lab work and, of course, a good interview of our client patient. And then we develop customized holistic lifestyle programs, completely drug-free, to try to correct any imbalance or dysfunction that we see with the lab testing.
So clients get prescription, yeah, based on their results and based on their health goals, right?
Well, pretty much. We don't call it prescription because that's more medical, of course, but we do make recommendations and suggestions. And not only do we figure out what's wrong with the lab work and give them a plan to fix it, but as health coaches or counselors, we work with them for a period of time so to make sure they do the things.
Here is the question. You said that it is not prescriptions because it's more medical term, prescriptions, but you suggest, you recommend, and I am curious, do you have medical doctors in your team?
Oh, absolutely. We have medical advisors, and they're there to give oversight for anything that might be an actual medical condition. But most of the suffering people have today is just chronic stress and downward spiral from chronic stress and bad lifestyle. So if they live themselves into the problem, they can live themselves out of the problem. And the lab work is just there to provide the guidance and education.
And what happens if you realize that your client has some conditions like illness, and do you still recommend something, or you suggest to go to the doctor?
It depends on that problem that you're talking about. If it's a true medical problem, like if you just suffered from a drive-by shooting, you're not going to call us, so you're going to go see your emergent care doctor. But everything else is our backyard. Anything to do with lifestyle medicine, your diet and your sleep and rest patterns, your exercise, stress reduction, and supplementation, it's our backyard. So we don't go in the doctor's backyard, but we work together and we know what people need. The doctors serve needs and we serve needs. We need to just focus on the needs and then everybody's happy.
So you suggest how to manage health, yeah? And you also mentioned that you have coaches. So I think biohacking focused coaches, and they work with clients, and they probably meet online. So interesting. How long is your course? How long is your program? And how many times clients chat with your coaches?
Right. So once we get the initial investigation, the underlying causes, conditions, the laboratory work done, what we're doing there, this is important, we identify healing opportunities versus medical diagnosis. Healing opportunities are much more comprehensive, all of the things you need to work on. Then we have to design the program to work on all of it simultaneously. And then we do the coaching. You said coaches. So they're coaches, counselors, advisors, whatever you want to call them. But they're just highly trained, and they love working with people. They love helping people. And
they work remotely.
Yeah, nowadays you kind of have to. Matter of fact, it was really not funny, but last year when other businesses were going out of business, we said we already work at home. Most of us already work at home. It didn't affect us. Matter of fact, our businesses all grew last year.
Yeah, I can guess that actually your business model grew last year in comparison with previous years when people more often visited coaches in person. Yes, so you are in a good position with your business model. Nice. And how long? When did you start? How long this company exists?
Yeah, I started in the business in 1999, so the last century. I've been doing this a long time. I've ran thousands of labs on thousands of people. I've trained over 3,000 practitioners or coaches, and I have an army of them ready to go to work to serve the people, of course. And we do have a course that I started in 2008. So I worked in the clinic for 10 years, and then I started teaching. And it takes about 6 or 8 months to finish our course. People have done it in less time, and even with COVID, they're staying at home. They have more time to study. People have finished it in 4 or 5 months. But the course takes that long. Now, once you finish the course, we also have an alumni association. So we have a professional association to hang out with each other. And, we go to virtual conferences now, but we also support each other. So there's a lot of peer support. And, of course, professional support from my organization.
Yeah, it's very important to have opportunity to chat with professionals and with community and exchange opinions. I understand. So you teach to become a coach, and what background should I have, for example, if I would like to become coach and I would like to complete your course? So what background I need before?
The truth is that the course is so robust. We teach all of the anatomy, the physiology, the biochemistry behind the lab work. So you really can explain it to the client, what's really going on inside the body. And again, I must say, this is not medical diagnosis or treatment plan. It's healing opportunities and then lifestyle recommendations. So it's 2 different backyards. And so people can take the course, and as long as they want to help others. You kind of have to have a passion for this work, but also you have to be willing to walk the talk, because the first requisite is you work on yourself first. So when you go through my course, you're going to run the labs on you, you're going to look at yourself, and you're going to follow the program. That's part of the program that people love. And so then they graduate and they want to help others doing the same thing. They've done it, and now they're going to help others. And there's lots of practical exercises, and we make sure they're well trained.
How many coaches do you have?
We've trained over 3,000 people.
Once again, how long is this course?
Yeah, it takes 6 to 8 months to do it right, to do all of the practical exercises, to get the labs done on yourself, to follow the program. So again, you learn by working on yourself, and then you can go out and if you join our post-grad group, you're going to get a lot of professional support. Mostly, I want to tell you that we're the independent health coaches. And when I started it, health coaches was not a word. It was just, you're just a practitioner, like an FDN practitioner. So you can go out and get a job if you want to work as an institutional coach and just work for a doctor. I'm now getting doctors asking me, how can I hire one of your people? But I'm an entrepreneur, so I think being working for yourself is wonderful. You can get up early in the morning. You can have customers anywhere in the world because you're working online. And then you could go play the rest of the day, or with your family or something like that. And the money, good income from it, because people are stuck in a cycle of trial and error. They're really frustrated. They can't get what they want from the medical system. So they're willing to pay outside of that for a professional coach to help them get the labs, get the right protocol, and then follow the protocol.
Regarding get the labs, as far as I know, people need medical prescription to get lab results, right? No.
So people have a right to get information on themselves, and that's all lab work is. It's just information. So we don't give a medical interpretation. We just explain what's going on. Here's what's going on with your hormones or your digestion. There are over 40 companies who are providing direct-to-consumer lab testing, over 40.
And I guess you recommend the best. You already know who is the best, yeah? Which is the best?
I have 20 years experience plus working with different labs, and I have my favorites. And there's no perfect lab, and there's no one lab. So you have to know what you're looking for: hormone, immune, digestion, detoxification, and so on. And try to use the best lab available to you, because in different countries there's different labs. So this has been a whole another part of the business I've had to learn. But the bottom line is the people have the right to the information. We're just helping them get it. And there's over 40 companies doing direct-to-consumer, including LabCorp and Quest, the biggest lab companies there are. They do direct-to-consumer. So we're not doing anything that you have to have a prescription for.
So you recommend what kind of labs to test and where to test. Regarding the geography, you mentioned that different labs in different countries. From what countries your coaches? From all over the world? Or most of them from the U.S.? What is the geography of your company?
Yeah, most are in the U.S., but Canada is huge. United Kingdom, more and more in Europe. Australia and New Zealand are really big because they want to know too. Everybody wants to know. So we actually have a coach in 50 countries, but some countries it's just one coach, and they have a hard time with the labs, frankly. But more and more people are seeing the value of this, and more outside lab companies, and there's third parties that handle a lot of labs. They'll consolidate for you. So we're finding it easier and easier for the coach to get his client or her client the lab work that they need.
Do you help your coaches get clients or no?
Yeah, all the time, because see, I go out and I speak a lot, and I get interviewed a lot for podcasts and things. So I have a place to send them, those viewers, so that they can get a coach. Mostly right now, it's the doctors who hear me. They say, I want a coach like that in my office, because the doctor is kind of handcuffed. He can only work with certain people, do certain things. They work with rules, algorithms, we call it. But a health coach is more free to do different things. So together, they can do a lot of good in the world and help people really,
Yeah, it's a great mission. And actually, it's also our mission. So I'm happy to have you as a partner. Thank you for supporting us. And thank you for being with us today. It was very interesting to learn, and I even interested in completing your program for myself. Really.
You're very welcome. Yeah, I'm really happy to be here. And when we heard you were doing the Congress, I said to my staff, I want to support them. They're on a good mission. It's a co-mission. So I want to sponsor this event. And then you were nice enough to ask me to come and speak too. So I'm very pleased. It's a great feeling in partnership.
Thank you for your kind feedback. Thank you very much. So, friends, stay with us. We will record more interviews with our partners.